The Alzheimer's Association is the brains behind saving yours. It's the third largest funder in the world of Alzheimer's disease research and the largest volunteer organization dedicated to Alzheimer's disease. Thanks to the efforts of elder law attorney Michael Cohen, KAAM and the Alzheimer's Association have teamed up to bring you Attacking Alzheimer's with the Alzheimer's Association, a weekly half-hour program featuring great minds who will shed some light on this devastating disease that affects so many. And now here's your host, Julie DeHardy.
Hello, everyone. This is Julie DeHardy from KAAM Radio, and this is Attacking Alzheimer's with the Alzheimer's Association. Today, we're going to talk about public health roadmaps, and I'm going to give you a little overview before we get started. The Alzheimer's Association is the world's leading voluntary health organization in Alzheimer's care, support, and research, and the association works on a global, national, and local level to enhance care and support for all those affected by Alzheimer's and other dementias. They are the leading voice for Alzheimer's disease advocacy, fighting for critical Alzheimer's research, prevention, and care initiatives at the state and the federal level. And the association is committed to accelerating the global the association is committed to accelerating the global progress of new treatments, preventions, and ultimately a cure. And of course, we have a vision, and that is a world without Alzheimer's. The Alzheimer's Association and the Centers for Disease Control and Prevention, CDC, has developed a series of Healthy Brain Initiative roadmaps to advance cognitive health as a vital, integral component of public health. So to discuss this, we have Molly French today, the Director of Public Health at the Alzheimer's Association. For more than 15 years, Molly French has been leading initiatives to improve the health and well-being of older adults. She works closely with state and national public health organizations to act on Alzheimer's disease as a priority issue. And previously, she consulted with national nonprofits on population health issues, directed policy research for National Prevention Policy Group and Advanced Health Policy in California. And in addition to Molly, we also have Ganesh Shivamayar. I'm sure I said it wrong this time, Interim Director of Dallas County Health and Human Services, joining us as well to discuss how the roadmap can be beneficial to the DFW community and how it fits into Dallas County's own initiative. So thank you both for being here.
Thank you so much.
So let's do a little...
And Julie,
yes, let's
Julie,
do...
thank you for having me on the show.
Oh, you're very welcome.
It's an honor and a privilege to be speaking here with you today.
Thank you so much for both being here. Let's do a quick refresher. Molly, what's the difference between cognitive impairment, dementia, and Alzheimer's?
Cognitive impairment is when a person has trouble remembering, learning new things, concentrating, making decisions that affect everyday life. And it's important to note that there can be many different sources of cognitive impairment, such as medication, side effects, or stroke. Dementia is just one of the sources of cognitive impairment, but it is a major source and one that's not reversible. When we're talking about dementia today, that refers to the loss of cognitive functioning and behavioral abilities to an extent that it starts to interfere with a person's daily life and activities. So cognitive functionings include memory, language skills, but also extend to visual perception, problem solving, self-management, and the ability to focus and pay attention. Alzheimer's is the most common cause of dementia, and it accounts for, we estimate, about 60 to 80% of dementia cases. There are other types of dementia. These include vascular dementia, dementia with Lewy bodies, and frontotemporal dementia. Finally, you did ask about Alzheimer's, and Alzheimer's is it's a progressive brain disorder, which slowly destroys memory and thinking skills and eventually the ability to carry out the simplest tasks. The symptoms usually develop slowly but get worse over time as brain cells become more damaged or destroyed, and people eventually do lose the ability to do activities that they've been doing most of their life.
So thanks for clearing that up for us, Molly. Now, let's go ahead and get into the public health roadmap. So what role does public health play in cognitive health?
Well, we think public health has a really critical role to play, both in terms of promoting cognitive functioning of people across the whole lifespan. And for audience members who are less familiar with what public health means, We are fortunate to have public health agencies at the national, state, local level that are out there each and every day, 24/7, promoting and protecting the health of communities wherever people are living, learning, working, and playing. While doctors provide essential treatment and care for individual people when they are sick, public health professionals try to keep people from getting sick or injured in the first place. Public health also promotes wellness by encouraging healthy behaviors. For example, it's because of public health that we can readily find flu shots when it's the fall season and time to get those vaccinations. And public health has done a tremendous amount in terms of educating people about the risks of tobacco. Julie, you asked what role does public health play in terms of cognitive health. So just like any other aspect of health, public health really does have an essential role. We do know that Alzheimer's is a growing public health issue. Many baby boomers are moving into their 60s and beyond, and age is the greatest risk factor for our developing Alzheimer's. Today, about 380,000 Texans have Alzheimer's, and by 2025, so not all that far away, we estimate that about 500,000 in the Longhorn State will be living with Alzheimer's. Nationally, Alzheimer's dementia does affect more than 5.7 million adults, including nearly 200,000 who are under the age of 65. By 2050, again with the aging of the baby boomers, it's expected that the number of adults affected will nearly triple, potentially reaching and affecting as many as 16 million Americans. Another reason Alzheimer's is a public health issue is because it's the most expensive disease in the U.S., with annual costs exceeding over $250 billion. And that means as Alzheimer's affects more people, as a nation, we're going to see the healthcare sector and other parts of our economy really bearing increasing expenditures. But we also have wonderful success stories of public health action in heart disease, cancer, and other chronic conditions. And with public health approaches that seek to prevent onset of any type of chronic condition, that improve diagnosis, making sure people get diagnosed early and have the tools and ability to better manage their chronic conditions. It's all these different strategies that have helped overcome growing and serious challenges in our nation from heart disease and cancer. And we'd like to see those successes continued and brought over into the world of on Alzheimer's as a public health issue. Just as we need public health to reduce risk for dementia and cognitive decline, we also need public health focusing on caregivers because caregivers are such an important part of the care and support that people living with Alzheimer's receive.
And so how do these roadmaps actually tie into Healthy Brain Initiative? What exactly is the Healthy Brain Initiative?
Well, in 2005, the Alzheimer's Association, we came together with the Centers for Disease and Control and Prevention with congressional support and formed the Healthy Brain Initiative, which has a goal of increasing public health awareness and action on cognitive impairment, including dementia as a public health issue. HBI partners, we all work together so that we can better understand and track the burden of cognitive impairment through tools like surveillance, data collection, and also, but particularly promote effective communications and programs and interventions and policies that help communities across the nation really address cognitive impairment and caregiving. One of the foremost ways we've worked to try and help the public health community understand its roles and responsibilities is through a series of 3 public health roadmaps. The first was published in 2007, the second in 2013, and the third was just released last month, so a few weeks ago, All three of them provide expert guidance to state and local public health agencies on effective ways to implement community change to improve cognitive health.
So it sounds like the association's really leaning on the public health to push out this initiative. So why does the new roadmap emphasize the need for public health to reduce health disparities?
We do know from science that there are critical opportunities to help populations, help groups of people reduce risk for cognitive decline and dementia. We know that there's a gap. Many people are not receiving a diagnosis until the middle or later stages. There's a great need for professional education and training and helping assure caregivers get the support they needed. These are all, traditional roles of public health that have been effective in other chronic conditions, and we'd really like to see those carried over into addressing Alzheimer's.
And the roadmap, they also emphasize partnerships and leveraging resources. Why is that?
Because Alzheimer's is such a large issue that affects all aspects of communities, and in fact, this is true for other types of health conditions too. Public health gets business done. It has that large-scale impact because it does engage and work with a large variety of partners. So some of the partners that we have seen work effectively with public health to address Alzheimer's include community nonprofits, different universities, healthcare groups, but also, kind of non-traditional partners such as county extension offices and local radio and TV stations such as yours.
And so as we talk about these partnerships, Ganesh, I suppose this is where the Dallas County Health and Human Services fits into the roadmap. So how does DCHHS successfully implement actions in the first two roadmaps?
Moving forward, we feel it's both important and exciting to start this partnership with Alzheimer's Association and then start moving forward in promoting brain health in the community.
So since the DCHHS first go around with the roadmap, Molly, can you tell us how the roadmap should be used?
There's been an important first step in terms of, connecting with our local Alzheimer's Association chapter. We're very eager to partner with public health agencies, so I appreciate your leadership there. Within the roadmap, there's an agenda of 25 different actions or ways that the public health community can address cognitive health through existing public health tools and techniques and programs. The roadmap actions are structured specifically so that they can plug into, in part, existing efforts. There are other actions that would take the development of new initiatives or other changes in policy systems or community settings. But because the number of people with Alzheimer's and other dementias is going to continue rising, there really is an urgent need for action by public health agencies, and we embedded a lot of data and pointed to some different resources so public health agencies can help get a quick start in terms of responding.
And Ganesh, which roadmap actions actually best fit the Dallas County's priorities and the opportunities and capabilities?
Yeah, Julie, public education is a fundamental public health role. I want to emphasize that people take actions to promote cognitive health requires clear and consistent messages. And what is yet to be discovered, and to that point, target audiences include, but are not limited to, older adults, children, employers, and people supporting an older neighbor or friend. Additionally, sharing accurate information using culturally appropriate health communication techniques would definitely seek to, number one, raise awareness about brain health, and then the changes in cognition that merit a conversation with a healthcare professional. The other point is basically to shift mindsets and normalize discussions about cognitive health in the routine delivery of healthcare to support early detection and modification of risk factors. And importantly, we are looking at improving access to available information, care planning, and then services to the community to support physical and behavioral health. I would also like to add here that social, legal, and financial spiritual needs and reduce stigmas, myths surrounding the disease. One point that I would like to make here is that public health here has strengths and capacities to advance awareness about the interplay between brain health and physical health. This will be done by linking dementia and cognitive decline risk messaging to health promotion activities in several areas. I'll name some areas here. Number one is tobacco prevention and control, cardiovascular health management, diabetes prevention and management. I think obesity and prevention control is critical as well as the injury prevention element. Public health is instrumental, primarily in educating the public. Needed component of preventing abuse, neglect, and exploitation. This is including financial exploitation of people living with dementia. As cognitive impairment worsens, people can become increasingly vulnerable to falling victim to elder mistreatment. In this context, I would like to add here that a person living with dementia may not recognize actions that could be harmful and have a difficulty promoting themselves. In addition, communication problems can hinder reporting or seeking help. The last point I want to add here is that cognitive impairment may also increase the risk of self-neglect for people living alone with dementia, especially as ability to perform activities of daily living gradually decline. Beyond public education, the public health community can actively strive to prevent abuse, neglect, and exploitation through partnerships with adult protective services, law enforcement. We have aging network service providers, and other community-based organizations.
So, Ganesh, how do you see issues like brain health, dementia, and caregiving fitting into your existing initiatives like diabetes or hypertension prevention and control?
Yeah, we recognize that brain health is important. As you know, DCHHS administers programs for older adults, and keeping the commitment to this community, we feel like we can address issues such as brain health and dementia, caregiving. I really feel like they're integral components of this community.
So are there any new initiatives that are actually needed?
Well, education and empowerment are essential components of the roadmap to brain health. We know that that's clearly documented. And then we are committed really to being your partner in that process, especially when I say yours, I mean the Alzheimer's Association. And here are some facts about brain health and dementia to that point. Dallas County has, as we all know, a large African American and Hispanic population. Brain health and dementia are important aspects that this population needs to be educated about. Some statistics here: 1 in 7 African American aged 45 and older report worsening memory problems, or what we call a subjective cognitive decline. Older African Americans are about 2 times more likely than whites to have Alzheimer's or other dementias. Another point here I want to make is variation in health, lifestyle, and socioeconomic. Additionally, accounts for most of the difference in risk by race and ethnicity. I want to give some examples here. So, number one is the high blood pressure and diabetes, which are risk factors for dementia. These are more prevalent in African American and Hispanic populations than in white. What are the reasons? Reasons essentially involve lower levels of education and greater levels of other socioeconomic characteristics and risk factors. Those may include poverty, adversity in early life, and access to quality care. Among some racial and ethnic minorities may also contribute to increased risk. In addition, African Americans with subjective cognitive decline often have other health challenges that may complicate care, such as physical inactivity, tobacco use, and living alone. Let me further this point by saying that misdiagnoses of dementia are more common among African American than white, while they are 2 times more likely to have Alzheimer's or another dementia than whites. They also are only 36% more likely to receive a diagnosis, and that's the reality in this community. Again, both African Americans and Hispanics with cognitive impairment are less likely than whites to say that a doctor has told them they have a memory-related disease. And lastly, of course, deaf information, having culturally appropriate messaging is important to creating awareness in the communities.
So how does this new partnership help the DCHHS assure Hispanic and Latinos are actually able to learn more about brain health and dementia and then get connected to healthcare providers?
Here's where I would like to add that African American populations, they need the learning and education. Partnerships with community-based organizations such as the Mexican Consulate that we have and faith-based organizations, they will assist with the dissemination of information from various channels. And as you know, as we build these collaborations with these different communities, our thrust with public health is to basically give them, empower them and educate them as the roadmap clearly indicates.
So this is such a great opportunity for promoting brain health. And, we're starting to run a little low on the clock here. So I'm going to wrap up today with one last question. And this one's going to be for you, Molly. LifeCourse Approach, that's mentioned in the road maps. Can you tell us what that is, what it means?
Sure. What it means is, some of the best opportunities that we're learning about from science indicate that, the time for thinking about promoting brain health should not begin as we approach our 60s and beyond, but it actually starts with efforts such as at DCHHS to assure that kids are being raised in healthy environments, receive good education, and goes across through each stage of life as our, different health risks change. It means, paying attention and helping adults, just as Ganesh so articulately spoke about, paying attention, helping reduce risk for cognitive decline in terms of keeping our hearts healthy, reducing tobacco use. And then as we get older, there's a public health role in terms of making sure that older adults, when they get their Medicare annual wellness visit, are assessed by physicians for cognitive health, as well as for those individuals who do go on and develop Alzheimer's and other dementias, that they receive the best quality care possible, that they're aware of, and caregivers know how to manage those risks, and that it also extends to thinking about that caregiver and that holistic view of health that public health has, so that caregivers can, continue in their role, provide effective support for people living with Alzheimer's, as well as, taking care of their own health.
Well, it's really exciting, all the partnership coming together, and I'm really eager to see what's going to be accomplished by all this and with the roadmap. So I want to say thank you so much for both of you being here today and, giving us all this wonderful knowledge and for everything that you do for the Alzheimer's Association.
Well, thank you.
I would like go ahead, Molly.
No, go ahead, Ganesh.
No, I was just, again, thank you so much, Molly, for being here and talking, these points through. And Julie, I want to say that brain health, dementia, and any of these symptoms associated with Alzheimer's disease are an important aspect of public health. We take ownership in this process. We recognize the important aspects that need to be addressed in our community, and we must, at this point, recognize the need to educate and empower the Dallas County community on aspects of early detection, treatment, and then management of these conditions. Again, I want to really thank you for involving me in this initiative.
Thank you, Ganesh, and thank you, Molly, as well. And thank you for everything that you do. There is definitely a need, like you said. We are going to conclude now, and we're going to learn more about the Public Health Roadmap and Healthy Brain Initiative. So you can visit alz.org/public health. And to learn more about keeping your brain healthy, you visit alz.org/10 ways. So the holiday season is here, and the season can be difficult on those living with Alzheimer's, their caregivers, and their families. So if you need any tips on navigating the holiday season, You can visit alz.org/help support. And the Alzheimer's Association offers round-the-clock resources and support for caregivers and families. All you have to do is visit alz.org/care to learn more, or you can call the 24/7 helpline. That is 1-800-272-3900. Again, the helpline, very important. There's always a human being that's going to be there to answer the phone for any question you have about dementia or Alzheimer's. So go ahead and call them if you need them. 1-800-272-3900. Thank you so much for joining us today. This has been Attacking Alzheimer's with the Alzheimer's Association. I'm Julie Hardy, and you have a blessed day.
This has been Attacking Alzheimer's with the Alzheimer's Association, a program made possible by elder law attorney Michael Cohen, who brought together KAAM and the Alzheimer's Association. Thank you for listening. Please join us again next week at this time for another deep dive topic surrounding the journey of Alzheimer's disease.